next one, what is your opinion of state funding for all-day kindergarten?
I would love to see it back in Melrose and Wakefield. I think that by charging tuition, which is in excess of $2,500 here in Melrose and is pushing towards $4,000 in Wakefield, we are stripping the public out of our public schools. And that is a trend I'd like to see us reverse. I think that there's a great deal of commitment. I spent many years as general counsel for the Office of Child Care Services. I really believe in early education. I believe in universal preschool. But I think that before we move on to the next phase of expanding that, we owe it to complete what we started. And that was all-day kindergarten in our communities. And I think that we need sometimes as a state to go back and complete what we started and to finish up and fund the good ideas and the programs that are really working. People in Melrose have voted with their feet, but they're also really paying out of their pocketbooks for this public education. I'd love to see those fully funded in our communities again.
Thank you. Mark, what's your opinion of state funding for all-day K?
Well, I will echo Catherine that the funding, it's a problem, and we need to determine where you can get the funds. And again, I need to restate that a lot of the newer programs that have been put forth by the governor and the legislature, we need to step back and look at some of the initiatives that we had started, and maybe finish on the initiatives that we have started. I have two children. One went to all-day kindergarten that was paid for, and the other didn't. And I survived with the one where I had to pay. But it is another burden on the taxpayers, and there needs to be a solution, and I just don't know if there's a solution out there right now, but it's certainly worth looking further into.
Thank you, Mark. And the next question's for you. Would you take any steps to increase funding for arts education in local schools? And why not?
We keep hearing about MCAS over and over and over again. And I have a concern that if we're putting so much focus on, and I will get around to it, Anna,
Okay.
putting so much focus on MCAS that if you set a minimum, the teachers are going to teach to a minimum. They're not going to teach to a maximum. So although MCAS scores are a good benchmark to have, I do think that we need to bring in some of the arts so we can have a much more well-rounded education. So I would support highly.
Okay. Catherine, would you take any steps to increase funding for arts in local education?
Absolutely. I think that part of funding our public school system is really the well-rounded experience. And whether it's arts, music, whether it's athletics, these are all part of what make a child have a full education. And that appreciation of the arts is something that we really can't start young enough. We're lucky here in Melrose that we have a wonderful and award-winning music program that we've really been able to keep, but it is a fight every single year in school committees in Melrose and in Wakefield to hold on to these programs. And it's a key part of education, keeping these extra, not core academic subjects, but core definitely to a child's experience in education.
Thank you. And you'll start this one. What is your opinion of the law requiring health insurance coverage of each citizen? And what modifications, if any, would you recommend?
I think that Massachusetts made a bold step, a historic step. We are the first state in the nation, and I think we are in the middle of an experiment that everybody is watching and certainly hopes to succeed. The projections for for the uninsured and what it was going to cost and how quickly those people are going to have moved into our system are way over what the Governor Romney at the time and the legislature anticipated. We have a crisis that is looming out there with this, and we need help from the federal government, and we need to think about our hospital reimbursements, our employee mandates. We need to keep working on this if it's going to work. I think that in the United States and in Massachusetts, we should have health coverage for everyone. But as state representative, one of my focus and priorities will be reducing actual health costs. If we don't get at the health costs, we are never going to solve this by simply offering more and more insurance. And we have to tackle that. It's key to our local budgets and key to our state's financial health.
Okay, Mark, what is your opinion of that law?
Universal health care is an excellent idea, and it's in its infancy. And when it was put together, I don't think anybody knew of the magnitude that it would be. So at some point, we are going to have to sit down and revisit the numbers. When we talk about health care, my main concern is Hallmark Health and the Melrose Wakefield Hospital. They're one of the area's largest employers. They are one of the area's largest healthcare providers, and I would certainly like to make sure that the decision that we make in going forward with the healthcare, we get a lot of input from Hallmark Health, because I think that's very important to our communities.
Thank you. And this is a related question for you, Mark. What, in general, this is not specifically a state level question, but what do you think can be done to reduce the cost of health insurance to our cities and towns?
To reduce the cost of health insurance, well, that's an excellent question. We have the mayor with the Group Insurance Commission. We have the mayor that wants to mandate that. There are some problems with mandating that, although it's a good idea. I'm not exactly sure we can do that, because there may be other avenues where where an individual could get cheaper health insurance through group programs. But that's probably one of the avenues to look into to help reduce the cost of insurance. That's a very touchy subject, and being self-employed in a small business, I certainly feel the pinch of that myself, and that has been something that I have always looked into with Mass Association of Realtors and National Association of Realtors, trying to find some way to bring those costs down.
Okay, Catherine, do you have any ideas about what could be done to reduce the cost of health insurance to the localities?
Well, I think, again, really reducing the cost of insurance comes down to reducing the ultimate cost that we pay for health care. And I think we have to look very hard at some of the other states, for example, New York and California, that have offer the similar high quality health care, have a great deal of teaching hospitals as we do in the Boston and Massachusetts area, yet do not see the same double-digit increases in their health care costs year after year after year. So I think we have something to learn there. I think we need to look at, nobody wants to give up on their doctors, on their nurses, on their physicians' assistants, but we need to look at some of the administrative costs, and is there a role for the state in helping us bring those down? And until we start addressing those underlying costs, we're never going to solve the insurance problem and the sort of budget busting properties that it's held for us.